Good afternoon, Mr. Smith. May I come in?
Yes.
The ward physician called me and informed me that you have developed a severe skin rash and itchiness right after the surgery.
Yes. It's very uncomfortable and it's itching like crazy.
Yes. Obviously, you had an allergic reaction to a medication that you received during surgery, probably the antibiotic penicillin, which we routinely administer as an infection prophylaxis during surgery. You received it before the operation started, but after the beginning of anesthesia, and that is most likely the trigger for the allergy that you are now having.
But I'm allergic to penicillin.
Yes, I saw that now that you had even checked the box in the consent form that you react to penicillin. Under the time pressure of this urgent surgery, I simply didn't notice that, and I also neglected to ask you explicitly before the anesthesia to make sure that you have no such allergies. I made an error for which I am responsible and that I truly regret. I should have taken time for this important clarification. For this, I want to sincerely apologize to you. I regret very much that you are now suffering under this impairment. In the future, I will take a close look at my patients' consent forms and ask them explicitly for potential allergies before I administer the anesthesia. I assure you, I have learned from this error. It will not happen again.
And how long will this persist now, this terrible itching?
We have begun a treatment now against this skin rash and itchiness, which is typically successful quite rapidly. But of course, one cannot expect that this will be now, so to speak, be over with almost immediately. It can certainly take 1 to 2 more days until the symptoms have completely disappeared. After that, you will not feel anything from the allergy or its symptoms. This incident will not postpone your discharge, and neither will your health nor your everyday life be compromised by it in any shape or form.
One moment, this is going a bit too fast for me. I have difficulties following you. So could you speak please a little bit more slowly so I can understand everything correctly? Or what kind of medication do I receive now? Will there be new complications from then? Or will this possibly get even worse? Or
no, you don't have to fear that now. Allow me to explain it to you. You will receive 2 medications. The first one is a histamine blocker. Histamine is the substance which causes all these symptoms, such as redness of the skin and itchiness, and cortisone. This is a standardized therapy and usually tolerated well.
But couldn't this all result in further complications from the cortisone?
Well, yes, that is possible in principle and happens at times. But technically, only when cortisone has to be administered over a longer time period, meaning several days or weeks, then it can certainly lead to alterations. But this is not a reason for concern in this case. I think you will need it for 1 to 2 more days, and then the symptoms will have disappeared.
Okay.
I am really sorry that you are so affected by the fact that I made this error of not following up with you about existing allergies. Please forgive me. Is there anything I can do to make up for this?
No, I can't think of anything now.
Okay. I'm in touch with my colleagues. They can reach me at any time in case you would like to have them call me in again. And I will also visit you once more before you're discharged from the hospital to make sure everything is fine. Do you have any other questions you would like to talk to me about?
No, not at the moment.
Good. Then I hope you will get well soon. And I wish you a good day and a good recovery. We see each other at the latest at your discharge.
Thank you.
Take care.